Returning now to our top story, 5 U.S. states are tracking passengers returning from a cruise ship hit with a deadly outbreak of Hantavirus. For more, let's bring in CBS News chief medical correspondent Dr. Jon LaPook. And doctor, another physician actually came up to you today and said, do we need to be worried about this? I mean, what did you say?
Yeah, just this morning. And, this is somebody with a lot of knowledge. And so what it said to me is, people are worried about this. And I think when they hear the World Health Organization today say, well, the risk to the general public is low, it's kind of triggering because they're thinking, well, is this going to be another pandemic? Is this going to be just like COVID? And there's a big difference. What I told her was, no, you don't have to be worried in general about flying. Remember that with the pandemic, COVID was caused by a virus we had never seen before, right? And we didn't know anything about it. This is a virus that we've known for 30 years. We do know how it's spread when it is spread. It's generally, you get it from rodents, from droppings of saliva, from urine, and you inhale it. However, occasionally, and really not that often, it can go from person to person, and it generally has to be pretty close contact.
Okay, so that's this Andes strain
the
that
Andes
we're
strain,
hearing
right.
about, right? And
right.
so
one of dozens of there are dozens of strains of hantavirus. There's only one that has been shown to go from person to person.
How do you define close contact?
You know what? The CDC, you really asked a good question. The CDC is going to be coming out with guidance about that because when you think about a cruise ship, that's generally sort of like a little bit of, I don't want to call it a petri dish, but it's sort of a lab experiment for close contact, right? I know there's a whole business there. I'm not trying to tear that down, but it is a place where people are generally interacting with each other. We know that the index case, was a man who then probably infected his wife. Sadly, they both died. You're in close contact with people. The question is what is close contact? And generally, it has to be sexual contact or people who are very close with each other, and not generally sort of people across the room. We remember with COVID, we found out that if you're in a room, we initially said 5 feet. If you're in a room that's not well ventilated, the virus can sort of aerosolize and go across the room like cigarette smoke can. So if you're in a room with 20 feet away, somebody smoking, you can smell it. That is not felt to be the case here. But we always have to have an asterisk here. We're at the beginning of this. You have to have humility. We're going to always end by saying, this is what we know now. And if something changes, we're going to let people know.
Are there any cases not associated with the cruise ship?
Not right now, no.
Okay.
They're all associated with the cruise ship yes, associated directly. So there were people who were passengers on a plane where the person who was on the cruise who got sick subsequently, developed full-blown disease. And now the question is, were they close enough on the plane to get infected? So yes, it's not directly from the cruise ship. But I just should say for the general public, the risk right now is felt to be low. You had to have been part of that, in that bunch of people who were sort of either directly or indirectly related to what happened on the cruise ship. And it's a great example of why you have to have cooperation between, the World Health Organization, the CDC, our own state departments involved, local health departments are involved, because you're trying to interrupt the chain of transmission. And that means like a lot of boots on the ground, finding out, who went where, when did they go. You have a long incubation period of 6 weeks around. So that means somebody could have gotten infected on the ship and then left the ship, and now they're somewhere else. You don't know where they are, how long. Yeah. Within the next day, I'm told by a source that knows the things that's going on at the CDC, that within the next day, you're going to see public guidance on when somebody has been sort of a contact. Not that they have it, for sure, they're in contact. What should they do? So stay tuned for that.
We'll be looking out for that. Thank you, Dr. Jon LaPook. Appreciate your time.